Dr. Irwin Redlener is the founding director of the National Center for Disaster Preparedness and senior research scholar at Columbia University's Earth Institute. Of course, MSNBC medical expert, and that is the day.
Yep.
Here he became Dr. Doom.
Yeah. Good morning, good morning, Dr. Doom.
Good morning.
We're very excited to welcome you as a new Stephanie Miller Show regular.
Yeah.
Because the news is always doomy now.
Yeah. Well, is there some sort of plaque or any kind of badge I get? How will I be known as?
All of it. You get all of it.
All right.
In addition to your other,
Maybe a mug.
There you go.
You have
We'll
a
get you a
mug?
nice mug.
Yes.
There you are.
Okay.
Well, but Doc, you are a pediatrician, correct?
I am.
In addition to all that, we just were saying earlier, it is astounding that even Facebook and Twitter had to ban Donald Trump because he basically is trying to get our children killed because he's losing his political campaign. I mean, and as you tweeted, schools in New York City and around the U.S. are opening with a random patchwork of policies, little science. These are uncharted waters. Don't be surprised if many schools must reclose. And there's Trump going, the kids don't get it. They're almost immune and they don't spread it. And I mean, right? It is just so,
It's amazing. You know, Israel, which was doing quite well in controlling the spread of the coronavirus, in May decided, well, they just would reopen schools, and it was a disaster. They had to close them again because, in fact, there were significant outbreaks in the schools in Israel. And even in the U.S., last week, you know, some of the schools, some states opened earlier than others. So in Indiana, in Georgia, in Tennessee, they opened schools that immediately developed cases of COVID in the kids. And you know, we just have to be very, very careful. And these kind of, especially come from a politician, and especially the politician Donald Trump, for him to make a medical statement is absurd. You know, it's like, we don't want to hear from you. You have plenty of doctors and experts who don't even agree with you. Let's hear from them. But, you know, and people listen to what he says, Stephanie. This is the other thing. Is he oblivious to that fact? But the fact is that people do listen to him. Yeah. And parents will make decisions based on what he said, especially about schools.
Well, Doc, I say it every day. The Israel example, the Christian camp, the few school districts that have already opened and have had to close on day one. I mean, it's so, and you said, you tweeted on the eve of opening schools, many in the big city and rural communities do not have the funds to fix defective ventilation systems, provide enough separation of kids, plus masks for every person in the school. You can't, you said the exact same thing I always say. You can't play Russian roulette with our kids' health or their teachers. That's what it is, because when he says they're immune, Doc, we all know the cases of the newborn that died, the 5-year-old that died, the first kid in Florida just died. I understand statistically. But as you say, if I'm understanding the studies correctly, you tell me, but from 10 on, you transmit it just as effectively as adults. And now there's a new study saying kids under 5 may actually have even more of the virus in their nasal pharynx, whatever that's called.
Yeah. The nose. Let's say the nose.
Yes, that, doctor, the nasal
they
pharynx.
had, even very young children carry a actually very heavy viral load. And so to assume that they're not either able to get sick or that they can't transmit it is ludicrous. It's just not true. Yeah. You know, you're playing with fire, Stephanie. When you are making statements outside your area of expertise and you have such a platform like that, you really can cause a tremendous amount of harm. You know, there's certain times where you need the specialist, you need the expert to say, well, this is what the data shows, and this is what my experience is. And here's what I think should be done, or here's what I think is reality. Once you have politicians stepping into those arenas of where you need high levels of expertise, you have a problem, a real problem.
Yeah, Doc. It strikes me it's not just dangerous to our children, to all of us. It's a story. Health officials tell MSNBC they get threats and hate mail. It's dangerous to you, to experts. I don't know if you get threats or death mail, but Dr. Oh, you do. I want to ask you, but Dr. Fauci said his wife and daughters have gotten death threats. Doctors are saying they've had to get surveillance systems. They're getting death threats. So you do just from being on NBC?
I don't get death threats, but I get language that I would not repeat on a family show here. But There's people that react, which is one of the things that, I'm not worried about it. And Fauci hopefully will have plenty of protection.
Yeah.
And he's a serious public figure. But I think it's reflective of the fact that there are still people that adore him, that think he's God, and will vote for him again. And that's why I think this November 3rd outcome is not in the bag yet, even though the studies are looking, the surveys are looking okay.
Yeah.
I'm still worried. There's a huge core of people that will vote for him no matter what he does or what he says.
Well, yeah, that must be, to me, that's new. Maybe you can tell me different, but I cannot believe people like you that are just trying to help save lives and are just trying to get facts and science out there, that this is what's happened, that this is our America now. Because you're speaking truth, I can't. Okay. You said this, I think on our show and on TV, and freaked everyone out, even for you, Dr. Doom. You said there's no doubt this death toll will rise. I wouldn't be surprised if we reach 800,000 before the end of this year. Trump is being extraordinarily irresponsible by politicizing mask wearing. Well, I assume you mean if we stay on this trajectory, and I get what you mean. How are we going to get off this trajectory till we have new leadership, right?
Well, first of all, the new leadership, when it comes to controlling this pandemic or future pandemics, is absolutely critical. We can't have somebody who doesn't believe in science, who's sitting in the White House and running our federal government. It just is. We can't have that anymore. And the 800,000 is an extrapolation. We pretty sure that half of Americans will catch this called SARS-CoV-2 virus that causes COVID-19. That means 160 million people will have it. The vast majority will have no symptoms or very little symptoms. 10% to 15% will need to get hospital care. But then way less than 1%, let's say half of 1%, will not survive this. That means that if you just do the math, we're looking at at least 800,000 potential fatalities if we don't really take a much more serious view of what we should be doing right now.
Yeah. Oh gosh, I don't know, where do you go next? You said this is, well, hopeful, but you said it's healthcare moonshot time. My sense is we're not going to see a moderate, watered down, gradual series of changes. Biden's public option will make healthcare secure for all Americans. I hate to say it, it's a horrible, horrible thing, this pandemic, but I think it is exposing how ridiculous it is to have people's health insurance tied to their work when there's this many people out of work and on and on.
Yeah. So actually I'm right now in the middle of writing a piece on the things that this pandemic has revealed. For example, the way higher rates of acquiring this infection among African Americans and Hispanics. And secondly, their fatality rates are much higher also. But the other thing which we're just starting to get exposed right now is that there are lots of communities around the United States that are simply deficient in medical care and have been for decades. So now when we have a big public health crisis, those places are in particular trouble. There's a horrendous story in the New York Times day before yesterday, I think, about these small border towns in Texas where they have 0 ICU beds and lots of sick people. And it's a disaster. And plus, many of your listeners may live in communities that are designated by the government as health professional shortage areas, means like doctor deserts, where there are just not enough doctors chronically. And of course, we still have lots of people uninsured. And this is why the non-COVID policies that Joe Biden would bring to the table if we're so lucky that he gets elected, would be the expansion of, let's say, the Affordable Care Act or something else that will guarantee health care access for every single American. This is one of these big reveals of COVID, which has been horrible.
I was just going to say, Doc, despite this whole debate, we may get to what essentially is Medicare for all. I mean, because of this tragedy. You also you tweeted about. I wanted to ask about testing because did you watch the Jonathan Swan interview with the charts?
Yes. Mm-hmm. Yes.
What'd you think of that whole section with the chart stuck?
He had, I don't know who had selected those charts and graphs and multicolors. He's sort of flipping through them and trying to show Swan, hey, take a look at this. And it had nothing to do with what the question was. And Swan would say, well, no, I'm asking you not about that. I'm asking about this. And the president was completely befuddled. That was a very, very bizarre interview. But again, what do we expect?
Well, I mean, there's no barometer under which we're not the worst in the world. There just is no, we are the worst in deaths. We're the worst in infections. We are 4% of the world's population, 25% of the cases. I mean, there just isn't any. But in terms of testing, I mean, not only are we not getting testing results back in time, we are only, I think experts are saying, still saying testing half as many people as we should. He still doesn't get per capita testing, but of course we have.
I think less than half, Stephanie. And the other thing is that, this line of BS that anybody can get a test anytime they want is just simply not true.
My friend has a concierge kind of doctor and said, it's not indicated. You don't have symptoms and you haven't been frontline, and she can't get a test, and she's having fatigue and a cough or whatever. But,
No, everybody should be able to get a test. But here's some good news. Am I allowed to tell you some good news?
Yes.
Well,
please.
It's going to throw the world off its axis, but go ahead.
So, actually, I think we're very close to having what's called point of care testing, which means that test kits that you don't have to send anything to a laboratory.
Oh.
So your doctor's office, your barber shop, the restaurants would be able to do with a little bit of saliva or a little nasal swab, be able to tell you in 15 to 30 minutes whether you have this virus or not.
Wow.
Which means what a great innovation that would be. For example, if you were a teacher and you need to go to work, you could get tested every day very easily and very inexpensively, and you'll know. So you're not sitting around in a mystery waiting to see if you have or don't have or spreading it or whatever.
But in terms of this whole critical thing of schools, you said with schools reopening in Texas, we don't do enough testing to begin with, especially with children. We just don't have enough information to make completely evidence-based decisions here, and the tsunami is coming. And we have flu season on top of it coming. So there's going to be symptoms that mimic stuff, right? This just... I mean, I always look at you and think impending disaster, but I'm just saying in particular. So the other thing, you posted an article, worthwhile read, on the complexities of vaccine development. I think you said it here first, Doc, that what a lot of other experts are saying now is they're afraid he's going to rush a vaccine or, FDA authorization like he did with hydroxychloroquine right before the election to go, look what I did, right?
Oh, a lot of people think there's going to be a series of what they call October surprises right before the election, where he'll make announcements of a miracle, that's arriving on November 4th, the day after the election, or he'll aggravate some sort of international conflict with North Korea or China or something. And I think it's essentially inevitable. And the more people talk about it, the more we'll be aware of it and not fall for it.
Yeah.
But I think when it comes to the COVID, of course, he's going to talk about the vaccine that you'll be able to get, next Thursday. And, it's just going to be a litany of things that are going to try to make him look good and like he's actually in control.
Yeah.
And I'm sure they're working intensely on those narratives, even as we speak, Steph.
And if you valued, science and data and experts like you, I mean, I've seen you on TV a bunch, and just a bunch of great suggestions about, how you could safely reopen and allocate money and funding. You said, you say your recommendation, hold off on reopening, consider all remote learning for the time being, but the federal government and states, perhaps with private partners, must make sure every child has internet access, appropriate hardware, mentors. I mean, there is a way if we had the will, isn't there?
Yes, we certainly, if any country on the earth has it, we have the money to be able to do that. And what higher priority is there than making sure A, people are healthy, and B, making sure our children are educated?
Yeah.
What a failure of a president who doesn't seem to get those priorities. It's not just the president, by the way. Look at the Senate and what's happening there too. We spend a lot of time talking about Trump, but we also have a guy named Mitch McConnell and his ilk in the Senate.
I know. And as you said, it's gonna make, as the virus is already worse in poor and minority communities, these schools that don't have ventilation, that don't have, aren't going to be able to afford proper anything. It's going to be, it's a tragedy just unfolding in slow motion. And thank you for speaking out, and thanks for offering to be a regular. We were so honored.
We were.
What do you think I am? I'm really honored that you said yes.
Oh.
I was like, oh my God, it's like getting asked to the medical prom. Goodbye, handsome Dr. Doom. See you next week.
Thanks,
Bye,
Doc.
beautiful. I'll see you. Bye.
Bye.
Dr. Irwin Redlener.